Hello. Hello, good morning on what the last time I looked was a very beautiful day, and welcome to the NHS Scotland event 2024. It's my great pleasure to be your chair for the plenary sessions here, and the theme of this year's event is Planning for the Future, delivering health and care services through innovation and collaboration, a theme that I think you'll see picked up throughout the day. There's a jam-packed programme. You'll find it on the app. Hopefully you've downloaded that onto your phone. And I hope you're as excited for the day as I am. There's a lot to cover. We know it's still an incredibly challenging time for health and social care services. So today will be a great opportunity to share your stories with colleagues and make important connections and celebrate success. So we're going to hear about successes as well as the challenges that we all know we face. And I tell you, I've been so impressed. I've had a chance to have a quick walk around the poster exhibition in Hall 1. There are 200 posters have been submitted. They are really fantastic. And if there's a taster of all the great work that's going on out there, you're going to find it there today as well. The supporter for this year is In Healthcare, the UK's leading provider of remote patient monitoring and virtual wards. I'd like to thank them very much for the support of this really important event. So, without further ado, let's get stuck into this landmark event for NHS Scotland. I would like to welcome Caroline Lamb, Chief Executive of NHS Scotland and Director General, Health and Social Care. Let's give Caroline a fantastic welcome up to this lectern. Thank you.
Thank you, Penny, and good morning, everybody. A very warm welcome to the NHS Scotland event. I know that over the past year, all of you and your colleagues, whether working for NHS Scotland or for its partners across health and social care, have once again worked tirelessly to deliver caring and compassionate services against a background of rising demand, increasing complexity, and unprecedented financial pressures. Across health and social care, we see extraordinary efforts from individuals and teams delivering services and support to people in Scotland, and I'm enormously grateful to all of you. As many of you will know, the First Minister has set out his overarching priorities for delivery by the government that I work for. They are improving public services, like our NHS, eradicating child poverty, tackling the climate emergency, and driving growth in our economy. And at the centre of those priorities is a determined focus on improving the well-being of people in Scotland, reducing inequalities, and harnessing innovation. Today, we've all got an opportunity to hear from colleagues, to learn from each other, and to think carefully about how we will work across our health and social care services to integrate these core priorities into the work that we do. You will shortly hear from Neil Gray, the Cabinet Secretary for Health and Social Care, who will share his vision for health and social care in Scotland and a reformed and more sustainable NHS. There is no doubt that our services have struggled to recover from the impact of the pandemic, together with the pressures driven by an ageing population and the unprecedented challenges from the cost of living crisis and the fiscal landscape. And all of that has caused additional strain for staff and for patients. Many of our services are under enormous pressure. Our hospitals are very full, and there are more people than ever in hospital with no clinical need to be there. There are also many people waiting longer for the care that they need, both in emergency and unscheduled settings and on waiting lists for planned procedures. That's not a situation that any of us are comfortable with. And it is more important than ever that all of us, Scottish Government, the NHS and partner agencies, work together to make the very best use of the resources that we've got and to get people the care that they need in the right place and as quickly as possible. We've been working really closely with colleagues in the Centre for Sustainable Delivery to ensure that we can maximise the flow through our hospitals, and we have already allocated an initial investment of 30 million, part of a planned investment of 300 million over 3 years to reduce waiting lists. That investment will support the reduction of long waits for appointments, diagnostics and treatments in various specialties, including cancer and orthopaedics. The majority of the additional activity will be undertaken between now and autumn this year, and it includes funding to staff additional theatre sessions, clinics and diagnostics. And whilst it is important that we focus on the here and now and ensure that we get the best value out of every penny that we spend to improve access and quality, we also need to find ways of managing the ever-increasing demand for our services. We know that Scotland's health is not where it should be. We know that the most important thing we can do to improve the sustainability of our services is to improve the health of our population through measures that will enhance prevention and early intervention and reduce health inequalities. So we are developing a population health framework, taking a cross-government and cross-sector approach to improve the key building blocks of health, including socio-economic factors such as poverty and housing, complemented by the promotion of positive health behaviours and empowering people to look after their own health. As we develop and implement those preventative measures and early interventions, we will also need to manage the here and now. And building on our commitments and the progress delivered to date, by 2026 we want to ensure that the care our people receive and their experience of the NHS has improved. To achieve that, we need to work together to modernise services and to ensure that those who use our services can benefit from innovation. The pandemic taught us all the ability to adapt quickly and to find new and innovative ways to deliver high-quality services. And through and since the pandemic, we have witnessed examples of transformation across many parts of our health service. It's these shining examples of best practice and collaboration that we need to share and extend into routine service delivery. In every visit I make to NHS board areas, I see fantastic and really uplifting examples of people working together, regardless of who employs them, to make a difference to the lives of the people that they support. And what is really clear is that the system as a whole only works as well as it possibly can for people when we all own each part of it, even the parts that might not impact on us directly. Making changes that help to realise and release the pressure in other bits of the system are just as important as making change that directly impacts on the services that we're responsible for. We are all part of making the change that is needed across our whole system. It's also clear that medical research is moving faster than ever, and new technologies are supporting individuals to better manage their own health and to prevent and mitigate the impacts of disease. I suspect that many of us here today, myself included, are wearing devices that help us to understand our own health and therefore take ownership of our own well-being in a way that was inconceivable just a few years ago. Recently, you will have seen that the Cabinet Secretary announced that we'll be investing up to 8.8 million to increase access to diabetes technologies. That funding will provide access to all children and young people that want it, and will also allow us to continue to increase provision to all adults living with type 1 diabetes. New diagnostics and screening methods are being introduced, such as the NHS Plenary trial for pre-symptomatic detection of cancer, and digital therapies such as our diabetes remission programme, which can help thousands of people to lose weight. There is also huge future potential in personalised and precision medicines and gene therapies, AI diagnostics, predictive data analytics, and robotic surgery. Critical to how we drive improvements in healthcare and reform services will be better underpinning of digital technologies and better use and sharing of data. If we're going to provide the best possible healthcare for our current and future population, then we need digital technology that is consistent, coherent, and ignores boundaries. It makes no sense to those who use our services, and it's not best of our limited resources to have 14 or 22 different versions where one makes more sense. So we will implement an NHS Scotland approach to harness greater levels of sharing and collaboration across our health boards and partners, resulting in better value, better quality, and better outcomes for patients and staff. Avoiding duplication of effort, having clear patient pathways, and improving the productivity of our systems, whilst minimising bureaucracy and using our collective resources to best effect, will be a key part of how we move forward to reform services and improve sustainability. And people must always be at the heart of our reforms. As we work to modernise the way in which we deliver services, we will listen to the voices of the real experts, people who use services and the staff who provide them. Enabling people to access the right care in the right place is central to the long-term future of NHS Scotland, and I know the Cabinet Secretary will have more to say on this shortly. So, a full day of discussion, analysis, listening, and setting actions lie before us. It's a time to meet colleagues, old and new, and to stand back from our daily routine and consider afresh what we have achieved and what lies ahead of us. So I encourage you to use this event as an opportunity to engage in debate, to consider initiatives, and to reflect on how we can best work together, not just today, but in the weeks and months ahead, to achieve practical and innovative solutions to our future challenges.